Kormeili, and I want to talk to you about wrinkles. Wrinkles are one of the most frequently asked areas in dermatology, and people want to know what they can do about their wrinkles. To really understand how to treat a wrinkle, we have to think about the wrinkles in terms of what type of a wrinkle it is. We have wrinkles that are at rest. If you make no expressions on your face, you still have that wrinkle. And they can be fine wrinkles or deep wrinkles, but doesn't have any movement and you still have those wrinkles. For those, we have to do laser treatments or creams. But what about wrinkles that come as a result of expressions, like frowning or moving your forehead up, or when you smile, those little lines that show up here? Well, to be able to get rid of a wrinkle that gets created because of a muscle movement, we have to be able to take that muscle and relax it. What happens is, as we go through life, we are constantly using our face muscles to make expressions. After a certain period of time, our muscles have done so many powerful expressions on our face that the skin has become damaged and it forms lines. And we often have those lines even if we don't make any expressions after a certain period of time. So it is really important to be able to get rid of these wrinkles that come as a result of muscle movement before they get really deep. So as soon as you start making expression and you see that there's lines forming, it's the time to actually start treating with either Botox, Dysport, or the newest form of botulinum, Xeomin. And the way that's done is by a series of injections that basically stop the muscle from contracting so much so that the skin has a chance to heal. And it gets rid of that wrinkle as the result of getting rid of that muscle movement. Now, many people always ask me, I don't want to look fake and I don't want to look overdone. How can we do it so I look natural? Well, the answer to that is to be able to use just the right amount and put it in areas where we basically just relax the muscle in a very natural contour and not create paralysis completely where you look really fake and it looks like you can't make any expressions at all. So I'm going to show you today treatment of forehead, so when people move their forehead up and down, those wrinkles that form, and also frown. Nobody likes a frowny face. So we can actually stop that. So even when you're making expressions and it looks like you are very animated, you don't have those big wrinkles that take away from how pretty your face is. So I'm going to demonstrate that for you now. So most commonly people ask me, how long does it take for me to see the effects of my treatment? So with Dysport, some people see the treatment a little earlier than Botox, but usually we tell people to wait about 2 weeks to see the maximum effects. But about 3 days it starts to kick in and you feel maybe a little tighter when you make expression, but over time you'll see that you really actually don't know that you're not making that expression the same way, and it looks actually like very natural. The other commonly asked question is, well, what are the side effects? In many clinical trials with all the Botox, Xeomin, Dysport, and all the botulinum, there has never been an incident, if you use the right product in the right concentration by a trained hand, having any complication outside the skin, like for example paralysis of vocal cords or not being able to breathe, all the horrible things that we hear on the media. As long as you use the right product in the right concentration in the right hand. A lot of times people use products that are a little cheaper or maybe diluted differently to be able to save on cost, and those are the complications and nightmares we hear about. So it's actually quite safe. And the other thing that can happen with any injection is you can get bruising. So bruising is probably the most common side effect that people notice. So we have given her some arnica to prevent any excessive bruising. We've actually numbed up her skin so it's not as painful. And we're going to use a little bit of ice to help constrict the little blood vessels and help with both pain and bruising. So I'm going to show you how we do that. So to get the right contour, we want to get her right anatomy and find her expression. So I want you to push your forehead up, honey. Perfect. Great, relax. How was that?
That's good.
All right, it was your first dose. Good. Push your forehead back up again. Beautiful. Go ahead, relax. Beautiful. Well done. And so on and so forth. We're going to do it until we catch all the little wrinkles. So now we've completed the treatment on the forehead, and you can see that there's these little blebs. They are going to flatten out. It's just where We've put an intense amount of the product. So now we're going to go ahead and treat that frown. So I want you to make a nice big frown for me. That's right, that's my girl. Okay, go ahead and relax. Okay, again, we're just going to go right into the belly of the muscle that we're trying to relax. Put just the right dose. Perfect. How was that? Painful?
No.
Another one? Another frown. There's my girl. Perfect. Relax. Excellent. Well done. Another frowny frown. Yay. Relax. There we go, sweetheart. Okay, one last shot. Okay. Big frown. There we go. And we're all done. She did great. Thank you.